out super quickly. Can I ask you to say and spell your whole name and your position, please?
It's Alan, Alan, Mautz, Mautz, MD, and I'm the radiologist at Northern Light A.R. Gould Hospital.
Thank you so much for taking the time to talk to us for the Star City Stories. October is Breast Cancer Awareness Month. Right out the gate, what do we want to remind not just women, but men too, the general population about where we are as far as breast cancer prevention and awareness?
So we're better off than ever before as far as screening goes, which doesn't do anything with prevention, but as far as detecting breast cancer earlier, before it's symptomatic, we have better technology with 3D mammography, with screening ultrasound as needed. And then in higher risk patients with significant family history or genetic problems, we have breast MRI that is another kind of adjunct screening modality. And then, a lot of it comes down to awareness. If there's anything new, if there's changes to a woman's breast, they should see their doctors, and they'll probably end up seeing someone in a radiology department somewhere to work things up. But if it's something new, it's always okay to talk to their doctors about it.
Two follow-ups with that. Yeah, talk about what about how, speaking of awareness, do you think that more attention is still being shown to this other than just October, or could we be doing a better job?
So I do think I think it's good to have October as a dedicated month to remind us and to raise our awareness of breast cancer. And I think that it's helpful also because there is some, as different societies and different payers, if you will, or people that provide guidance, there has been some back and forth between medical professionals and then the people that, like, without trying to be pejorative, are bureaucrats. And we people that take care of, they're actually involved in taking care of women. We all recommend starting at age 40 and doing breast screening annually, unless there are mitigating factors that would cause us to start screening earlier, if there's a significant family history, those kind of things. And until recently, the U.S. Preventative Services Task Force actually recommended starting at age 50 and doing it every other year, so biannually, and which is not what the studies and not what the data and what the science shows is reasonable or smart. And so they backed off to starting at age 40, which I think all of us that are involved in this are grateful for, but they're still at the every 2 years. And so I think there's still some give and take. So I do think that there is a reason for us to pursue every year the October breast awareness. And then I think that it's reasonable for women to, when they see their doctors, talk about breast cancer screening and make sure that there aren't any changes. It should be part of their conversation with the doctor, at least annually, and then more often if there are any changes in the woman's health.
What are still the primary ways to do kind of prevention or awareness? And I know one of those is a self-breast exam. What should you be looking for?
So much of it is change. So that means that that a woman is doing a breast self-exam if they're doing them monthly and roughly the same interval between menstrual cycles, because breast tissue can change during a cycle. And so you'd want to do it basically the same time. About half, mid-cycle is a good time to do it. And then if there's anything new, and so a lump, mass, if there's any changes in the skin, if the skin feels thickened, if there's any discharge from the breast. So those are the kind of the basics, but anything new. If you're feeling and you feel something in the armpit region, that should be, that would count as being part of the area of concern when it comes to breast cancer. And then I think awareness is keeping it, as silly as it seems, we have appointment books and those kind of things that keep us on track. It's okay to write down what you're feeling or what you're not feeling, so that month to month, and can recall what things felt like or looked like, any changes from month to month. And I think with the busy world, it's better to write things down, whether electronically or with a pen and paper, just so that so that we know from month to month how things change.
What about for young women? I know in the past couple of years, and like you said before, we were thinking about women 40 and up, but certainly in the past 20 years, we found that more younger women are becoming diagnosed. What about that particular age group?
Yeah. So obviously, I mean, the main thing in that scenario, from my perspective, um, younger women tend to have denser breasts. So not to be too worried if you feel an area that feels denser or feels more mass-like. Every woman's breasts are different as far as how much breast tissue they have. But something that's hard, that's not movable, if it feels fixed. And I think like starting probably beginning at eight, and there aren't really there's some back and forth. The recommendations about breast self-exam and even physician breast exam goes back and forth. There are a lot of kind of false positives as far as the physical exam goes. So kind of knowing your own territory,
Right.
knowing what things feel like, so that you can appreciate when there's a change. And so obviously we do breast cancer screening with mammography beginning at age 40, but that should never prevent someone who's younger than that from knowing what their bodies are, so they can know how things change.
What role does nutrition and a healthy diet and exercise and all of those kind of exterior factors, what role does that play in relation to this?
So there's not like great data, but there are obviously things that any physician should recommend, and I do too, as someone who pretends to like fitness. Physical activity is a good thing. So risk factors that are kind of lifestyle things. Obesity is a risk factor for breast malignancy. Actually, it increases the estrogen load, because that's one of the things that fat cells do. So if you have too many fat cells, it can you have like a hyperestrogenic, so more estrogen than one would otherwise have. So being physically active can help with that. Avoiding as much as possible obesity, and then healthy diets. So we don't think that, as far as we know, there aren't like vitamins or supplements that can help prevent breast cancer. But we do know that maintaining a healthy weight, eating well, being physically active, all of those things contribute to reduce risk of all types of cancer, but breast cancer specifically. And then while we often think about cigarettes as a lung cancer and head and neck cancer, they also can contribute to an increased risk of breast cancer, as can excess alcohol consumption. By excess, we're not talking we mean more than one equivalent of a beer a day for a woman. So when you want to take it, kick your feet back, just remember that there's consequences, I guess. I don't know.
No, you're fine. And what about, I guess, certain ethnicities? I know that, for instance, the rate is a little bit higher for Black women, for example.
It is. So in women under age 40, actually, there's a higher risk of breast cancer. And so for Black women, earlier screening is reasonable, especially if there's a family history. The coin kind of flips, if you will, after the age of 40. The preponderance of breast cancer tends towards white women, and then Asian women a lower risk overall compared to Black and white women. And in all things, I think we know that those kind of epidemiologic studies are sometimes flawed. Medical care and access is less easy for Black women, and so those data may be a little bit skewed. I think it's important for every woman to take advantage of things that are available, but especially in vulnerable populations, to be more aware of their increased risk. And as painful as it is, I tell many of my patients this: you have to advocate for yourself in the modern health world. It would be great if I and my colleagues were better than we are at advocating for patients. We do as not as much as we can, but we do a lot, but it can never be enough. And so it is truly a kind of a partnered paradigm where patients and physicians need to work together to make sure that the patients are getting everything that they deserve.
I certainly second, third, and fourth that. And finally, we don't hear about it enough, but it does occur. So we want to educate about also men being able to be the statistic. Yes?
Yes. So the main thing with men, like obviously if you have a first degree relative, that puts you at risk, whether it's a man or a woman. Men are susceptible if they have the genetic mutations that would make a woman susceptible, less susceptible than a woman who has a genetic predisposition. And the rate of cancer in men is far less. I mean, orders of magnitude less. Like 1 in 8 women will be diagnosed with breast cancer in a lifetime, and men it's about 1 in 750 or so. But it does happen. So there are things to remember. It's the same kind of thing. A new chest wall lump in the breast area should be seen by a doctor. Now, most men, when that happens, it's a condition called gynecomastia, where the tissue behind the nipple areola region becomes overgrown, and that happens from medications, from marijuana use. It can happen for reasons unknown. It happens in people with liver disease as well. But that's not to mean that if you have something behind the nipple region that you shouldn't have it checked out. And it, certainly if it's away from the nipple and it's a new mass, it definitely should be checked out. And even if it's, there is a stigma, we still call it breast cancer, even though it's in a man, but that's just, that's just words.
Yeah, it's just verbiage. Very important messages. Anything else, just kind of finalizing that people need to kind of a positive takeaway?
Just, I know that there is, it's I don't know the right word. It's not politically charged. It's not emotional or anything like that. But it is, it's a vulnerable place to be in. What my technologists ask women to do to undergo a mammogram is not an easy thing. And I have wonderful technologists who take excellent care of patients. And I think one of the things to remember is that we're here to help. That at no point do we want anybody to feel like they're unheard or too frightened to come in. There's enough fear already. Just know that we're here to help. And that my technologists, as wonderful they are, I don't even know that I can appreciate how good they are to my patients. So just know that we're here to help. We're here to answer questions and here to take care of you.
Well, the first step was having this conversation. We so appreciate you, Dr. Mounts, and your staff as well, being able to dispel fact from fiction and making people understand it's important to first have the conversation and maybe to come in and do what we need to do so that we can stay healthy and alive and spread positive education. And you're helping to do that. Thanks for taking the time to talk to me. I so appreciate it. Always good to see you.